another edition of Your Health Matters with Dr. Benjamin Bryant, Chief Surgeon and Chief of Staff at UH Conneaut Medical Center. And Doc, how you doing today?
Nice and warm.
Oh boy.
I think summer's here, Pat.
I think it's here. It's here for a while anyway. I had a guy tell me the other day, well, 4th of July's over, the end of summer is near. I go, don't say that. We still have a lot of time left.
I've got a weather app.
Yeah.
Okay, and I look out over the next 10 days, and it's in the mid to upper 80s every day.
Oh yeah. And
Summer ain't over.
The only thing, and I'm really glad you did that show a couple weeks ago with Dr. Kumar on sun and heat and all that stuff, because right now we're experiencing a lot of humidity, and it's good not to overexert yourself.
This is exactly the weather where you want to be careful.
Yeah.
This is exactly, especially, you know, if you've got heart condition, lung condition,
Yeah.
kidney condition, or are over the age of, gosh, what should I say?
Oh, don't
90?
mention my name.
Over the age of 90, over the age of 70, you should really be careful.
Be very careful. Yeah. We have a guest today, and you've been on my show, the old show that I used to do,
A couple
Andrea.
of times, yeah.
Oh, is that right?
Yeah.
A few times.
No kidding.
Yes. When she walked in, I go, you've been on the show before, so nice to see you, Andrea.
Nice to see you. Thanks for having me.
Yes, Andrea Balogh is here from our hospital, UH Conneaut, and she's going to describe a program today. The general public really doesn't know too much about this kind of stuff, but the people who are affected by the conditions that she will describe, they know it all right, and it's not rare. It's not rare at all. I imagine that most people out there have either experienced themselves or know someone who has experienced swelling in a limb, arm or leg, that can be very troublesome. So, Andrea, I just want to, you know, I'm getting to know some things about this myself. How long have you been here at Conneaut?
I think this will be 5 years
5
that
years.
I've been here. Yeah.
And what led you to come here?
Change, I guess. I've been an occupational therapist in pretty much Ohio ever since I got out of college, since 1999. So I was spent 11 years in long-term care, working skilled nursing, and
Oh, my goodness.
just a lot of changes in there. So I needed a change and came over here and love it.
You love it here?
I love it.
You like our
Yeah,
hospital? You
I
like
love
our
it.
town? I feel the same way.
Yeah.
How could you not? I mean, it's
Yeah.
such a great place.
Yeah, I love the staff. I love the smallness. I love being connected to a larger organization, to have that.
Sure.
Just all of those connections, which kind of led me to where I am today with my specialty, because I was enabled to be able to go out and further my knowledge base and bring that back to this community.
That's what it's all about. That's what it's all about.
Andrea, just because I'm kind of dumb, occupational therapy, could you explain that to me?
Yeah,
For all of us here.
well, I think everybody has a little bit of a different explanation, but how I define myself is I focus on, especially in this hospital setting, I focus on safety and being able to get you back to your home, being able to get yourself out of bed, get yourself into the bathroom, on and off the toilet, being able to dress yourself again. And people will tell me, oh, I've been dressing myself for 81 years now, honey, you're not going to tell me anything different. But it's a lot different in the fact that depending on what they're dealing with, if it's, you know, a new joint, they might have to do things differently. If it's pneumonia or if it's an abdominal surgery, there's a lot of precautions that you have to follow, or you might have to do things a little differently. And occupational therapy is blessed with the ability to kind of take a situation and modify it, use tools, and we really get to know our patients, know what their living situation is like, know what their support system is like, and then we kind of pull our bag of tricks out and figure out what works for people and send them home as independently as we can, so that they can live in their own home environment as long as they can, aging in place.
Are some of these problems caused by falls, or?
Yeah, could be falls. It could be something traumatic. It could be an elective surgery. It could be anything that they come to the
A
hospital.
severe illness.
Yeah, pneumonia,
And they
anything
can, and they do
cardiac
that right
related.
here, they do that right here in UH.
Right.
In the
Anything
local.
that they can take care of medically here, we will see the patients in the hospital, because we all know that hospitalization, you don't have as much activity. You don't feel good, but you're also limited by the four walls that you're
Mhm.
staying in. So you can get weaker, you can lose your strength just by being in the hospital. But if
It's routine. It's absolutely routine.
Right.
I mean, if somebody comes in, somebody comes in, they're doing okay, and they get pneumonia. And it's enough of a pneumonia that they have to be hospitalized. Okay, that's a severe infection. And you're in bed, you're having intravenous antibiotics. So the disease process itself is taxing you, all right? And the fact that, as Andrea says, you're inactive and can't be doing stuff, that weakens you. So when you leave the hospital, you are not in the same shape that you were when you came in.
Okay.
And you may not notice it. You may not notice it, but it's there. And so the thing that you don't need to do is, okay, well, I feel better now, my chest x-ray's cleared up, I'm not having fevers, I'm gonna go home and not realize and fall and break your hip. No, thanks.
Yeah. Then you've
No.
got other issues.
You've got huge problems if that happens, or you find you can't react as quickly, and you can't get something off the stove that you have to. I mean, there's just so many things where you're not really prepared and not really aware, and that can lead to problems. It can lead to serious problems, which are avoidable. But the other thing is this emphasis on independence and on people being able to live in their homes and stay in their homes. That is so important to the overall well-being, particularly of elderly folks, to be in their familiar
Sure.
place. It's just crucial. And a lot of what Andrea does is to strengthen that and maintain that and protect that as long as possible.
Now,
So what I'm saying is, folks, you should listen to her when she talks.
Yeah, but let me ask you, I have a prescription that I have to have physical therapy. Would that be through your department?
Yes, yeah. So I am, I'm the team lead for this hospital, and I report back to a higher manager, but I basically coordinate everything in our department. So we have speech therapy, we have physical therapy, and we have occupational therapy. So we have a secretary up there. We take patients in from the community and treat them Monday through Friday, and then we also service the patients in the hospital.
And that is by appointment, correct?
The outpatients, yes, the
Okay.
people that are in the community coming to see us are outpatient
Okay.
for appointment.
Very good.
Well, I see that you have some pictures here
I
that
do,
you're going to show
yeah.
the folks. Why don't you introduce this subject? What
Okay.
is this all about?
So I recently, last year, got lymphedema certified, and I had dabbled in it since 2007, where I worked at a place that graciously had a lot of nice shadowing abilities with another one of my coworkers.
Let me ask you, what is lymphedema?
Lymphedema
Thank you.
is basically an abnormal swelling. It is not the typical edema. So edema is a swelling in a limb, or it can be in the trunk, it can be in the face. But edema is different than lymphedema because edema is very fast onset, related to injury, a sprained foot, a surgery of some sort. It's very quick onset. And the type of edema, like the contents of it, is different. Where lymphedema is very slow onset. There's multiple types. There's a primary lymphedema, there's a secondary lymphedema, and I think a lot of people, if you know about lymphedema, an abnormal swelling of a limb or trunk, you're more familiar with it from a cancer related, somebody who's had lymph node removal and whatnot, and that's a secondary lymphedema. But primary lymphedema is where people are born with an abnormality. So it could be a chromosomal abnormality where they didn't have as many lymph nodes in a certain limb, or they have too many lymph nodes.
I'm going to take a step back here just for the public. Edema just means water, basically. You know, there can be some fancy chemicals in there, but what happens is everybody knows, all right, the heart pumps and blood comes out of the heart through the arteries and it goes everywhere. And we're going to be talking primarily about the legs and the arms. So the blood goes down there to support the tissues, and then it goes into finer and finer capillaries, and then it comes back in the veins. And the blood goes back into the heart and the veins. But out in the tissues, fluid comes out of the blood vessels. Fluid, not blood, fluid. Because the blood vessels, the blood cells aren't in limbo in there. They're in a solution. They're in fluid called plasma. All right. I don't want to get too technical here, but it's not that hard to understand. And plasma, it bathes all the cells. And that's where the oxygen comes from. That's where the sugar comes from. That's where the carbon dioxide goes back to, is in this solution. But this is outside the blood vessels.
I really didn't know that.
Yeah.
It's a leaky system
And it has
by
to
setup.
be.
Right?
By setup, it has to be, so that the nutrients and everything can get to the tissues. But you got this fluid sitting out there. Well, it has to get back into the circulation too. Now, how does it do that? Well, it goes into these little channels that are called lymphatics. That fluid is called lymph. If anyone has ever had a blister, okay, and you pop the blister, okay, this clear fluid comes out. That's lymph.
Really?
Yeah, that's called lymph. That's just the name of it. That's the fluid that comes out of the blood vessels to bathe the tissues to support all physiology.
Huh.
Okay?
Okay.
And so that's the fluid that's got to get back into the circulation, and it goes into these little fine channels that coalesce to get bigger and bigger and bigger until they go back into the circulation. Now, all along those lymph channels are what Andrea has just told us are lymph nodes. And lymph nodes are like little guardhouses, okay? There's a lot of immune cells in there because a lot of things can come back in that fluid, okay? Busted up cells can come back in that fluid, all right? Cancer cells can come back in that fluid. Bacteria can come back in that fluid, and routinely does, okay? But when it hits those lymph nodes, a little war goes on, okay?
They're like a filter.
Yeah, and the immune system is scoping everything there. And if, for example, if a cancer cell comes in there, the immune system will say, hey, enemy agent, you don't belong here. Boom, and it kills it. Just instantly kills it. Or bacteria will kill it. Okay? So it's really protecting us. And so there's lymph nodes all along these lymphatic channels bringing this fluid back to the heart. Now, folks, that may be more information than you want. But that's kind of how it works. But that helps you to understand what happens if the lymph can't get back. Then you get lymphedema.
Right, you get the limb. So that's what it is. The swelling will stay in the limb. So to kind of support what Dr. Bryan said with the lymphatics, they're pretty much set up right along all of our blood vessels to kind of catch that extra fluid. And I think it's about 15% that the lymphatic system is responsible for getting back to its normal job. It's to get it back to the heart where it gets recirculated. So when you have a problem where the lymphatics were damaged for some reason, or there's not enough of the lymphatic vessels or not enough of the lymph nodes and whatnot, that fluid stays in the limb and can cause damage. So it can cause scar tissue, it can cause hardening of the tissue. That circulation doesn't get back, and so the limb just starts to slowly over time get bigger, and it's almost not noticeable to a person, and because it's so slow that it changes. It's like looking in the mirror every day. You don't kind of recognize those slow changes.
Let me
until
ask you this,
somebody
Andrea.
says-
I've always wondered about this. When I was a kid in high school, I had a teacher that had cancer surgery. And I'm not sure if it was breast cancer. I wouldn't know that then. But she had one arm that was very much bigger than the other arm.
That would have
Is
been-
that what we're talking
Yes,
about?
That's exactly what we're talking about.
That's
That's
exactly-
one example of lymphedema and the reasons behind it.
Okay.
So I like to explain it to my patients, and you say that's probably more information that you want to, but people are thriving for this information. A lot of people don't know about it, or they'll go to their doctors. Not all the doctors that they'll go to have a ton of information on this,
Well,
and
you
they'll
know,
say
the other
thank
thing-
you for
Sure.
explaining that to me. You know?
Exactly, and Pat and I have, it's been very clear to us through the years that the more knowledge people have, the more empowered they are.
Mhm.
The more they understand what's going on with them, the more comfortable they feel, then they understand why stuff is being recommended and why it's being done. And it just gives people a sense of security and a sense of control if they know what's going on. So our bias is always to give as much information
Right.
that's useful as we can.
Right. So yeah, so in my explanation, I'll talk about our lymphatic system is like the garbage collectors. They'll go around and collect that extra fluid, get it back to where it needs to be. Okay. So we started talking about primary and secondary lymphedema. Secondary lymphedema is a result of an action. So whether it could have been surgery, and not just cancer, surgery for cancer, but it could be just a typical routine surgery, or a hernia surgery could have that outcome. It could be trauma. So there's lots of reasons. It's whatever happened, you get the outcome of lymphedema down the road. And that's when you come for an evaluation with me, I'm asking you all of those questions and trying to figure out kind of what the source of, why is this edema here? Is it truly lymphedema? Where did it start from? So I have a couple of pictures that I'll show you, but primarily what I see is lymphedema resulting from secondary lymphedema. It would be surgery, cancer, a lot of venous stasis, chronic venous insufficiency, and I have seen some lipedema, which is a whole nother ball game, but that's a fat disorder where your body metabolizes what you eat into fat. And there's a specific presentation, but it can lead into lymphedema. So lipedema doesn't start out as lymphedema. It starts out just plain old lipedema, but because of all of that extra fat and extra tissue, it damages the lymphatic system and therefore results in a combination of lymphedema.
Let's show that.
So this is a picture. I'll try to hold it up as
And Matthew can get,
okay.
he can zero in.
There we go. So this is a pre and post picture. This lady had left arm swelling, most likely from the cancer, from a surgery, probably breast cancer. They removed lymph nodes. And the moment that somebody has removal of lymph nodes, you're already at risk at some point. It doesn't mean that you're going to get lymphedema. There's no way to identify when or how somebody's going to get it, if they ever get it. But you're at risk if you have removed lymph nodes. So with the compromised flow, that left armpit, where most of those lymph nodes are, couldn't keep up with the swelling. So it was kind of like a traffic jam. If you think about an accident, right at the point of the accident, fluid is moving slowly. So we're going to say that armpit area is where the accident is. The fluid is moving very, very slowly. Other areas of the body are trying to pick up. But where you get that back jam of the accident is a mile or two back, where everything's kind of stopped and halted. And that's where you get that swelling in the fingers and the wrist first, and then it can slowly go up the forearm, up the arm. And that swelling will kind of stay stagnant until you can get it moving. And that's where lymphedema therapists, we do a combination of things. We'll do what we call complete decongestive therapy, CDT, and that includes a type of manual drainage. Some people will call it massage, but it's not really a massage. I'm going to put this down here. It's when you think of massage, you think of hard pressure, you think of pushing into the muscles. And the lymphatics, they lie very, very superficial. You know, most of them. There are deep lymphatics, but they lie literally above your muscle, below your skin. So it doesn't take anything to kind of crush your lymphatics by pushing too hard. So our manual techniques is we have a couple different strokes, but we're distracting the skin, and we're basically trying to increase the motility of those lymphatic vessels and to start unclogging. We start to kind of move that fluid from out of the arm and over to the unaffected areas.
So the swelling eventually could go down?
Yes. So that's one part of complete decongestive therapy is the manual technique, and then we use a combination of like wrapping, compression wrapping. We use foam. I use multiple layered bandages, and we'll wrap that entire extremity. So between compression bandaging, the manual techniques, proper skin care, some deep breathing exercises, and that our focus is to, if this is, you know, a left arm swelling, our focus is to kind of push that swelling to other lymph nodes, to maybe the opposite side.
To balance it out?
Yep, maybe we'll push it down to the groin, into those lymph nodes, and we'll stimulate the deeper lymphatics, because we want the body is brilliant in a way of kind of picking up where one part of the body is slacking. So we basically reestablish different highways to where that flow is. So we're taking it out of the affected arm, out of that swollen limb, and transporting it to a different area so that it can get recirculated.
Doc, is that something, because the teacher I was talking about, I don't believe it ever went away. I mean, is this something newer than...
Well, the question would be there is what kind of therapy did she get, if any?
If they had it even,
and
I'm talking
stage.
60s now.
Yeah.
This is something that was newly founded in Germany and brought pretty much to the U.S. around the 90s. So especially in the last 5 years, it's really started to come along. But there are different stages of lymphedema. So we have a stage 0. Stage 0 is that person at risk. You know, they may never get beyond stage 0, but if they had lymph nodes removed, they're a stage 0 automatically. We have a stage 1, which is a reversible lymphedema. So right away with early detection, and that is the key. Early detection, identifying that you're a risk, and then when you start to notice a heaviness in the limb, just a different sensation in there. We might be able to take measurements between the two and not notice too much, but maybe by the end of the day your limb is starting to swell. It disappears when you elevate it. By morning it's gone. Stage 1, you could stay at stage 1, but most of the time, if you're at stage 1, it's only a matter of time going to stage 2, where you get more of the tissue changes, the fibrotic skin, the hard lumps. The swelling doesn't go away with the elevation. It's not gone away by morning. And then it can turn into stage 3, which is kind of what you see, the elephantiasis, those huge limbs, those abnormal shapes of the limbs. That's stage 3. So our goal is education, is to be able to identify people at risk and be able to have that early detection so that it's manageable.
What stage would you say that is?
That is probably a stage 3, I would say. So this is lymphedema on this side, and we talked a little bit about lipedema. Okay, that's the same type, but lymphedema is one limb. Okay, and you can see how large that limb is compared to the opposite. Okay, this is tissue changes, that very fibrotic tissue, very
scarred.
hard.
Yeah.
I don't know if you can zoom in on that enough, but that skin color is very brawny. It's like a brownish color. To me, that's also, there's some vascular issues in this person's.
Is that reversible? That particular leg?
This is not reversible,
Okay.
no. We
Is it
can.
treatable?
It is treatable. We can get it maintained. We can get you smaller and get it manageable. So lymphedema is a disease where edema is not. Edema is that, the body's sending in all these extra cells into the area for healing. If you had surgery, if you sprained an ankle, where the difference is, lymphedema is a disease. It will never go away. I can never give you a pill right now. At this time, there's a lot of research out there that's trying to figure out what to do and if it works. But it's a disease and you have to manage it. And so that part of when I see people and I'm telling them for the first time, yes, you have lymphedema. Well, will it ever go away? If you wrap me and my arm gets smaller, can I not wear anything? And the answer is no. From now on, you have to focus on monitoring your limb, making sure that you have good skin, you lotion the skin, you wash it, dry it, and that you wear the proper compression garment. So a lot of times the doctors will say, well, I want you to wear a pair of compression garments. This is what you need to do now. So if you go into the doctor's office and your legs are swollen, a prescription for a pair of compression garments isn't what your next step needs to be. Your next step is to be able to kind of get that swelling down as much as we can, and then we'll fit you with a pair of compression garments, because that's going to maintain the limb at that smaller size.
All right, Andrew, that second picture over there,
This one?
Yeah.
Okay.
The upper leg,
Yes. So
the thigh area, that's what's...
This is lymphedema, okay? And there's a great YouTube segment on the fat disorder. It's highly underdiagnosed, but and this is probably a stage 3 here, but you can see that it's both legs are involved as compared to one. And the fat deposits, typically it's in women. It's the deposits are from the hips to the ankles. So you can see that her feet are fairly spared. Now she's more of a later stage lipedema, so she's turning into a lipolymphedema. So there's starting to be some chronic tissue changes there. But you'll see that people have like this shelf from their hips to their ankles, and their feet will be skinny. Their ankles may be skinny, but all that fat gets deposited from here to here. In these early stages, if you're diagnosed with lipedema early, our goal is, because in a lipedema patient, the lymphatic system is functioning properly. It's just that the body is processing everything into fat and depositing it in this location. So our first goal is to get them fitted with compression garments. Okay, and then once it advances beyond where it's a combination of tissue changes in that, then we have to start with the manual, the massage, and then get them into compression garments. So I want to take a little bit of time and just talk a little bit about compression garments. The reason this is they work so well, and compression, when we talk about wrapping a limb, whether it be a leg or an arm or even the trunk or face, we do not use ACE wraps. So ACE wraps are elastic. We use a short stretch bandage, so you pull it and it only stretches so far. And what we're doing is we're building a pressure on the external part of the limb. So you have blood pressure, you have a pressure inside the arteries and the veins that is, when the pressure is higher in those arteries and veins versus the tissues, fluid can leak out because the pressure inside that tube is able to push out into something that's not giving back. So if we increase the pressure on the outer portion of the limb, we can decrease the amount of fluid that's leaking out of that tube. Okay, so we rely on when I wrap somebody and I compress somebody, this isn't something that I would wrap and say, okay, go and put your feet up in your recliner or in your bed and rest there, elevate your feet all day. No, we rely on activity. So I want that person moving, I want them walking, I want them exercising, because our lymphatics, different than our cardiovascular system where it's operated by the heart, it pushes and forces all that fluid to come back around. Lymphatics aren't like that. So we rely on muscle pumping to get that back to the heart, to kind of push that back. So you have compression on your limb, and now your muscle activates and pushes up against that wall, and you're basically just pumping those lymphatics.
This is an extremely important point, and I think it's one that's not really well understood by the public, or even necessarily by doctors that much, is that no, you don't want to sit home with your feet up all day. That's counterproductive. This idea that you're providing the external support, and then it's the muscle contracting just in the course of walking or any normal activity, the muscles contract, and when they do, they push up against that elastic, and that forces the fluid where it's supposed to go. See, and that's something you learn when you come, when you have this kind of problem, you come to somebody who really knows what they're doing, because they can keep you, within the therapies and the approaches based on a real understanding of the problem.
Right.
And okay, I mean, there's lots of people out there who've had blood clots in their legs, or just have had congestive heart failure or what have you, who have a lot of fluid in the tissue. Oh my gosh, my feet swell. Oh my gosh, my leg, I push on it and it's like the Pillsbury Doughboy.
Right.
It just goes, a lot of times docs will say, okay, compression garment, that's what you need. And I think a very important point that's been made here today is that, yeah, okay, that's going to benefit you, but it's not going to fit properly until the initial therapy's been done. Otherwise, it's going to be too big, it's not going to do its job. Let's approach this rationally. Let's do it in sequence. Let's get your limb down to where the compression garment is appropriate, and then get the garment so it's actually going to do its job. This is the kind of thing that this kind of expertise brings to bear on the problems. And I'm sure that there's lots and lots of people out there who've either had swelling, know people who've had swelling, and there's real help that is available for that. Sure. It's not just a question of, okay, take more Lasix or...
Right, and I get that a lot. If people will say, "Oh, I wanted my doctor to give me a water pill," and I try to explain a little bit about, water pills are appropriate for certain scenarios, but not for all. And some people will say it didn't work. Lymphedema is an edema that has high protein in it. Protein molecules are very big. They can't get reabsorbed back into the bloodstream because they're so big. So your lymphatics go around and gobble up those protein molecules and get them back. Well, when your lymphatic system is not working properly, or it's slow or stagnant, you have all of these extra protein molecules hanging out in your tissues, and protein molecules are hydrophilic, so they attract water. So they're pulling all of this water out of your blood system into your tissues because of that high protein edema. So when you have a water pill, it's pulling that water back into the bloodstream, but the protein molecules are still stuck in the tissue. Nothing has changed mechanically. So as soon as you stop that water pill, those protein molecules pull all that water right back into the tissue. And kind of explains to some people why the water pill isn't working. Is it because it's not a congestive heart failure, it's not a chronic venous insufficiency. Maybe it was because you had a mechanical problem with your lymphatics where we need to get that protein edema out of the limb. So I see a lot of chronic venous insufficiency, and part of my job is when I come in and I evaluate a patient, I'm looking at all of the comorbidities. What was your history? Have you ever had these specific conditions. Because when I talked about the process of coming in, evaluating them, and I do a manual lymphatic, I do the drainage with my hands, then I do the compression with the wraps, and then I teach you about exercise and proper skincare, is that some people can't tolerate all that manual drainage, cannot tolerate that fluid being pushed to a system that can't handle it. So there are certain precautions that we have that I look at your history and say, okay, this person has history of congestive heart failure, so I'm not going to push that fluid back to the heart, but maybe more appropriate just for compression bandaging. So I might skip the manual part and just do the compression bandaging, and we get enough success from that we control the edema. I also fit patients for compression garments.
It's important.
So there's a whole variety of compression garments that are out there. So people will tell me, I've tried them, they're painful, I don't like them. And I try to get that out of people's head initially, is that what have you tried before? There's a lot newer things on the market. Compression hose that you pull up like stockings, thigh highs, they've got zippers, but they've got Velcro bandaging now. So it's also part of my job is to figure out, in the end, I'm right away from day one, in the end, I'm looking at what are my options for getting you into a garment. Do you live alone? Do you have shoulder problems? Are you going to be able to pull on a simple compression hose, or do we need to look at alternatives? There are devices out there, multiple devices. I've got a couple in my clinic that will practice, because one tool that works for so-and-so doesn't work for the other person. So I've got a multiple devices that we can try and figure out, because not only do we want to get your limbs smaller, but ultimately when you leave me, I want you to be able to be independent with getting them on, getting them off, being able to wash them, and following through with the schedule, because you could spend 4 weeks with me, and in the end, if you can't do that, it was a waste of time.
Andrea, Doc and I always hit on this end of it too. A person that's on Medicare, a person with regular insurance, is this covered?
So that's a good point, and I was going to get to that, is yes, the therapy is covered for your treatment and what we do with pretty much all insurances. What's not covered, and I want people to kind of be more proactive with that, is the garments. The garments are usually not covered. The wraps that we start, usually all out of pocket and can be very expensive. And by all means, I want people to kind of be proactive with their government, with their legislators, their senators, and their House of Representatives, and know like who's supporting certain bills. There's a lymphedema treatment act, and you can go to I think it's lymphedema-treatmentact.org. And sign, and they have letters that you can print right out. You can just put your legislature's name right there and put your name and print it out, that you can email it, you can get it right to them. But it's really important for them to be on board with this new bill, and that's going to require Medicare and other insurance companies to pay for this as DME, as durable medical equipment. And right now they do not recognize it.
Might
as
seem like
DME.
a big hassle, folks, but this is how change happens.
Mm-hmm.
Yeah.
This is how these things actually happen.
I can't believe they wouldn't pay for the products.
It's insane. It's completely irrational.
Wow.
Mm-hmm.
That's amazing.
We have the majority of the House we have on board with this bill. We're still lacking the Senate right now. So, I'm not sure what the local. I live in a different state, but we should be aware and make sure that we kind of flood them with, they need to be on board with this, because if it's not you being affected, it's somebody close by. I mean, we know a ton of people that have swelling issues, and the cost can be, for a person, it could be as low as $50, $60 for a pair of stockings, and it can be up to $2,000, depending.
No kidding.
Yeah, depending on the severity of stage 3 elephantiasis, where their limb is just taking all kinds of abnormal shapes, they have to create that garment custom. And most of the time it's in Germany.
If they're on a fixed income,
Yeah.
It's out of reach.
It's terrible.
Well,
Yeah,
and
it's out of reach.
every 6 months, these garments need to be replaced. So this is really, really important. This is a picture of a chronic venous insufficiency here, and you can see the color changes and whatnot on this person, and then this is an after of where we got that person, and you can see the differences in color. I'll show you this one too. So that's the back of the leg. So you can definitely see the changes in the color of the skin and the shape of the limb and whatnot.
Got that, Matt?
Yeah.
Okay. So I see a lot of this that can be fixed very quickly, usually 2 to 3 weeks.
Now, we always like to ask, how do patients come to see you? Can they come directly, or do they need to be referred?
They need to be referred by their physician, so just call.
So this is another one of those things just to write down, folks. When you go in to see your doctor, a lot of times the doctor will pick up on it, and sometimes they don't. And you don't have to be stuck with that. You can say, I'm starting to get some swelling, or I've got some pretty good swelling here. I would like a referral over to OT to help manage this swelling. And the doctor will give you the referral. I mean, that would never be a problem.
Right.
And so you do need the referral, but you can ask about it. You don't have to wait until it's offered to you.
Mm-hmm.
You can ask for it.
Right.
And then they'll give it to you.
And ask for it quickly. If the more proactive you are, the quicker you can nip the swelling in the butt and manage it, maintain it.
Like so many other things that we talked about, picking up on it early saves so much grief.
Yeah. Yeah. Now, the next picture she's going to show real quick, we want to alert you that they are a little graphic, and she'll explain it, and you'll explain what's going on here.
Mm-hmm.
So go ahead.
Yeah, this is just from one of my textbooks, but this is a limb that started out with vascular issues that turned into damaging the lymphatic system and ultimately ended up with lymphedema. But you can see, it's not the clearest picture, but there's a lot of skin things going on, a lot of hyperkeratosis there, there's some open wounds, and that's kind of where I was getting at with my last conversation, is that when I see people with chronic venous insufficiency, it can lead into, if it's not taken care of, lead into ulcers on the legs.
Which are very difficult to treat.
Very difficult. So you're looking at months, if not years, to heal up from these venous ulcers. And this is just a good picture of where this person is now with the lymphedema therapy. So here at this hospital, I have
What a difference.
Yeah.
Oh, it's just, think about your quality of life, folks.
Right.
If you're living with this, as opposed to living with this.
Right.
This is what we're talking about.
Right. So we work with, I can work with the wound care in this hospital, and they could be treating the wounds, and then as I'm wrapping and getting this person smaller, the wound size goes down so much quicker. It's amazing. This is a good picture of, this is one treatment for this person. One time of wrapping, and they come back 3 days later and all of the wounds are closed.
That quick?
That quick.
Not always, folks, not always.
Yeah.
Right.
But very, very quick, much quicker when you're getting that protein-rich fluid out of the area, and you get that swelling down as well. You have room for the medicine and the wound dressings, or the IV antibiotics can then get to the tissue, can get to the area.
Exactly.
To be able to heal and do what it needs to do. But when all that edema and that circulation is, basically stagnant, it's very difficult. It's hitting a roadblock. So a combination of you know, wound care and lymphedema therapy and compression wrapping can really make a difference in somebody's quality of life, for sure.
Folks, we encourage you, as we have on so many things that we've discussed on these segments, we encourage you to take this seriously, to understand that there are implications to this, that it's a progressive problem. Starts out kind of slow and small and doesn't seem to really mean too much, but it's a highway into these kinds of things, and the earlier that you intervene in it, the less grief you're going to have.
Right.
The easier it's going to be to treat, the less costly it's going to be to treat, the better you're going to feel.
And easier to maintain.
And easier to maintain.
Right.
Fascinating. Wow, I didn't realize it was so in-depth, you know, what you do. And
Yeah. I love it, though, because you can really change somebody's life.
See, and folks, I have to say this, you know, part of my job, I have to say these things, okay? Conneaut. Look at the caliber of therapy that's available at Conneaut.
Thank you.
Okay?
I really didn't know it, and I've interviewed you in the past, but I didn't realize it was so.
Yeah,
So far
I mean,
advanced.
and this is, you know, this is because we're affiliated with University Hospitals, which enabled Andrea to get her training, but it's also a function of the culture that we have at this hospital. And it's why why we win the 5-star. I have to say this because it's just reality.
Right.
It's because this is why Conneaut wins the 5-star awards.
Yeah.
One of the few hospitals in the state to do that. It's a commitment to this kind of excellence. So we're really, really thankful that you took the time to come and talk to us today, Andrea.
Yeah, thank you for having me. And, just on a side note, if you're going to get this treatment for lymphedema, make sure that you're going to a lymphedema certified therapist. There are multiple levels of training. I ended up going to one of the more extensive where I had nine straight days of training, but there's sometimes people are doing this just off to the side with just reading through books, or sometimes they'll go to a 1 or 2 day course and they're not as qualified as the lymphedema certified therapist. So there's ways to look up when you get on the internet and look up who's certified in this area. I think it's really important to know because the focus of medical history and
the other thing is, folks, that in our community you're simply not going to have that problem because
I'm the only
We're the only one that can do it.
Well, but you have access to that here. So anyone who's seeing this program or who wants to look at it later up on YouTube, I should.
Could you explain that too? These programs are now on YouTube. Of course, I think you're like me. You're not real. Do you know about this stuff? Computers? I am not.
Oh yeah.
Okay, I'm not good about that.
Well, there was a little bit of a I would say a couple of problems to solve in making these shows available to the public. But, I mean, beyond what's being broadcast by the Cable Advisory Board on 6 and 19, okay? These shows, I have a YouTube channel. If you go up and you go to YouTube and you put in Your Health Matters, 3 words, Your Health Matters, and then my last name, Bryant, okay, and you do a search, boom, you'll see some videos, and then you can go and subscribe to the channel. And virtually all these shows since mid-November of 2015.
You got them all on there?
I have 3 more to put up, but I've got all of them, almost all of them, and those 3 will be up by the end of the week.
Wow.
And you can go and all the guests that we've had, all the shows that we've had, you can go back and look, because there was a wealth of information that Andrea provided.
Right.
Just tremendous, okay? And sometimes it just kind of flies past you because you're trying to assimilate. But you can go and zero in on different segments and say, oh, what did she say? And what's this? So you can go and really get the value out of it. So just go to YouTube and put in the search, put Your Health Matters and my last name. And You'll see
Pops up.
videos, and once one of those videos pops up, you can just subscribe to the channel, and then you'll see all of them.
Okay, great. That's a good service too. So it is very hard to follow a live interview a lot of times because you're not sitting there taking notes. So if you can go back and look at these replays, you can get a lot out of them. That's a good idea, Doc.
Absolutely, absolutely. All right.
Good job today.
Thank you.
She does such a great job.
Great job. And don't forget, folks, we'll be back in a couple weeks. And Doc and I are going to do a special segment where he will answer questions from you, the viewers out there, that have sent these questions in over a period of time. And we haven't had a chance to get to them, but we're going to get to them
In
next
2
week.
weeks.
In 2 weeks. So watch out for that. And remember, always number one, your health matters. You did it, kid.